Well, good afternoon. I'd like to welcome you to another episode of Living United with Nashua Business. This show is all about connecting the business community with the remainder of the community and talking about how businesses get involved in giving back and supporting all of us who live and work in the greater Nashua area. Today, I'm very excited about having with me two representatives of the two major hospitals in our community, St. Joseph Hospital and Southern New Hampshire Health. And so with no further ado, I'm going to introduce our guests today, Dr. Joe Leahy.
Hi.
Joe, welcome to the show.
Thanks for having me.
And Dr. Jane Wieler.
Hello.
Welcome to the show, Jane.
Thanks.
And I'm going to call you guys Dr. Leahy and Dr. Wieler. We'll keep it formal today. How about that?
Okay.
Sounds fine.
So there are so many ways in which, so many important things for us to talk about when it comes to healthcare options in our community. I think we're very lucky to have two incredible institutions, St. Joe's and Southern New Hampshire Health, serving us for so many years. Before we jump into that, though, I did want to, just for purposes of the show and transparency, make sure that everybody understands that both hospitals are also partners and supporters of United Way. So we appreciate that and want to make sure everybody's aware of that too. So with that said, why don't we start out with just some quick introductions? Dr. Wieler, why don't we start out with you? Tell us a little bit about yourself and what you do and what your role is at St. Joseph Hospital.
So I'm currently the medical director of the emergency department at St. Joseph's. I grew up in central Massachusetts and did my training. I slowly moved west and then came back east. I did residency down in Philadelphia at Hahnemann University Hospital, which is associated with Drexel Medical School. And I've actually been working at St. Joseph's in the hospital ER ever since then. Slowly moved my way from EMS medical director to assistant medical director. And as of last year, I've been the department chair and medical director. I still treat patients frequently, between 6 and 10 shifts per month, depending on need. So I'm still actively engaged. And I serve on multiple committees in the hospital. And my focus at work is process improvement and optimization, efficiency, and really keeping my coworkers happy. really keeping them
like
happy.
A good boss. I appreciate that. So when did you officially take over the emergency department at St. Joseph's?
Last June.
Oh, really
Yes.
recently?
Yeah, 1 year ago.
Congratulations.
Yes, thank you.
Very good.
Yeah, I live in Hollis. My husband is an orthopedic surgeon here in Nashua, and we have 2 young kids. So we are
School
very
age?
active. They're younger than that, toddlers.
Oh, my.
Yeah,
Oh.
yeah, we are busy.
Do you
We're
have boys or girls?
one of each.
Oh.
Yeah, busy.
Wow,
busy
hats off to you.
times.
That's a
Yeah.
lot. Congratulations on all of that.
Yeah.
Thank you for that. I appreciate it. And Dr. Leahy, how about yourself? Tell us a little bit about your story.
Sure. So I've been at Southern now for, this is my 29th year, and I'm an emergency physician as well. But I was in the emergency department for several years, then became ED director for about 14 years. And about 3 years ago, stepped into the role as chief medical officer of the hospital. So oversee the medical staff, credentialing, and all the ongoings of the medical staff within the hospital. Serving again on a lot of committees, and certainly in the role of chief medical officer, being out in the community a lot more as well, engaging with partners in that regard. My emergency medicine training was down in New Jersey, in the Newark area, but I was pretty much raised in Massachusetts and was anxious to get back to New England. So we came up to Nashua and found a home here.
So you are both really from this area, more or less originally, and coming back.
Exactly.
That's great. They call it the rubber band bounce back kind of generation. People who go away and they're like, oh no, I want to go back.
Yeah.
It was great there. So
Sure.
Good.
Sure.
Well, congratulations and thank you. When did you become the chief medical officer? You said 3 years ago?
3 years ago.
Okay, very good. Well, thank you for that. So I want to start out just with a general conversation about what are the different types of care available to people in the community. And this can be everything from chiropractic care to your primary care physician, emergency departments, all the different types of modalities exist. A lot of that is also within the hospital network itself, but others things as well. And so I'm wondering if one of you can just kind of jump on in and talk a little bit about, I'm a person moving to the community. What are the medical options and healthcare options available to me?
Sure, and there are many. Certainly, there's chiropractic care is one area. There is affiliated with hospitals. There's primary care options. There's urgent cares, and in Southern we have immediate cares, which are a version of an urgent care.
Yeah.
And then there's the emergency departments for both hospitals, as well as the freestanding emergency department that we have now in Nashua. So many options in that regard. Primary care is still when people have issues. They should try to get to their primary care if they can. But for emergency cases, certainly there are the acute options.
Are you still finding, and maybe Dr. Wieler, where you're seeing the emergency department really every day, are you still seeing this problem, which has been around for, I would imagine, quite some time now, where people are accessing the emergency department for types of care that maybe aren't appropriate for that setting?
Yes, I think when you're new to the community, establishing care with a primary care physician that's associated with a local hospital will do you the most good, because you can kind of go through them and connect all of your healthcare together through that PCP. It's very difficult for anyone to determine if they feel ill where they should go. And urgent care would be for things like scrapes, maybe a broken bone, you had a bat flying in your house, you need some rabies vaccines, tetanus shot, things like that. So if you're acutely
ill.
Sounds
like something which might have happened.
Yes.
And you're like, that story came very naturally to you.
Yeah, yes, I did in medical school, and then I had to go to an urgent care for the rabies series. So you could go to the ER if the urgent cares or immediate cares are closed. But we see all kinds of concerns in the emergency department, and I think it's very difficult because sometimes you'll get on the phone, you'll call your PCP, and the nurse will instruct you to go to an urgent care or an ER. But they're doing that for a reason, and they have protocols to go through so that they can help you navigate. So starting with your PCP office is really usually the way to go.
Yeah, I think it was before we even started talking, somebody mentioned the public health department. What role does public health have in all of this, as well as places like Lamprey Healthcare and Harbor Care that are federally qualified health centers? How does that fit into this whole picture as well?
I think they're an integral part of all of that. They really play a key role, especially for people who either don't have insurance or are new to the area, or if there's public health issues that come up, they're actively engaged. I think we have a great relationship with the public health department. Our Lamprey services do an outstanding job of managing a large population in Nashua. But they need partners as well. So when issues do arise that are more complex for what they can see in the outpatient clinics, they're referred to the emergency departments.
One of the things that I've often wondered is, as a patient, what if I go to like one primary care doctor who maybe is affiliated with, say, St. Joseph Hospital. But I end up in the emergency department at Southern New Hampshire Health. How do you all communicate with each other? Because I'm just one person, right? And you're two different doctors, potentially, two different places. How does that work to make sure that I'm treated appropriately?
Luckily for our two systems, we are both contracted with the same software companies. So the electronic medical records, all of the notes, the images, the information for those patients can be transferred over. If the patient gives us permission, we can view everything in multiple systems. So in Southern New Hampshire, we're very lucky that St. Joseph Hospital, Southern New Hampshire Medical Center, and Elliott Hospital are all using the same software. But we are a capitalist society, and that extends to the business of medicine. So the other facilities in New Hampshire have to actually paper fax us records. And there are usually delays in obtaining that information. So if you go to the other healthcare facilities locally, you're at risk of duplicate testing for blood work, for imaging. And then also your complete medical history might be unavailable. So then you're telling the person in front of you 5 different times what medical issues you have.
Yeah, I'm thinking of the case where my aunt a couple of years ago moved up here from New York City, and she had a pretty complicated medical history, including cancer and a lot of surgeries. And when she came up and started going to access healthcare here, it was virtually impossible to get for the local healthcare people to get like a complete picture of her history, and even what medications was she taking and why, and that whole picture was pretty difficult to get.
Yeah, it can be very difficult.
And you still see that today, I presume, depending upon.
Yeah, I mean, fortunately, a lot of hospitals are on the same or similar software that electronic medical record that we have. So even for some patients who go down to Mass General or any of the hospitals in Boston, Tufts,
Leahy, Burlington,
they
Beth
are all in the same
Israel.
system. So when they're visiting or they're coming up after having a procedure, we have access or can get access to that and see the notes and all the lab results there. So it does certainly save a lot of time and effort, as well as a lot of extra testing for labs and CAT scans and such.
A person who is accessing care, should they ask about this? Have you ever had somebody say, well, what system are you using and who can you talk with? I mean, is that a logical question for a patient to ask?
I'd say it's not a bad question to ask. I think a lot of patients, I find, are pretty adept now with dealing with electronic applications. So many of them have their own, MyChart ability to get into a system for themselves and see their test results as they're happening. So they're fairly intelligent when it comes to understanding the systems that we have. And certainly when they're within our own systems, it's very much helpful for them as well as for us to kind of remain in that system.
Yeah, it just occurred to me sitting here, like when I've established a relationship with healthcare providers in the past, I've never thought, well, what medical record system are you using and who can you communicate with?
It's not really a question that you ask until there's an issue or you find out that there's a hiccup.
Right, you won't know it until you need it.
Makes it challenging.
Yeah, absolutely. You know it, but the patient might not. That makes sense.
Yeah.
I wanted to talk just through a couple of scenarios then, since we have so many different options in our community. And I think you mentioned one of them about like the bat. We won't talk about that. That was not on my list of questions, to be honest.
I've been there as well, with the whole family.
With the rabies shots?
Yes.
Excellent. Good to know that these are both options with both hospitals. But so I have a bad case of the flu, and it's been a couple days, and I have a headache, and I'm coughing, and I have, I'm congested and feeling pretty lousy. Where do I go?
Well,
what do you think?
I think it depends on the patient's age.
Okay.
And their medical history. So if you're taking lots of medications, you have a pill planner, you have like 6 in the morning, 6 in the evening, you might want to think twice about going to an urgent care when you have the flu and feel really terrible. But if you're younger or maybe a child, you could definitely consider urgent care as an option.
I completely agree. That's what I was going to say.
Okay, so you go to urgent care and call your PCP first? Get some advice before doing that?
Yeah, you could also be seen in your PCP office for flu-like symptoms.
All right. Yeah. So I'm running down the road and I start feeling like I feel like dehydrated. Maybe I wouldn't describe it that way, but I'm feeling a little woozy. Maybe signs of heat stroke kind of coming on. Who do I call? Where do I go?
Yeah, I think in that situation, you'd want to think maybe a little bit more in depth about where to go. As far as urgent care, it may not be the best option for you because if you need IVs or lab work, they may not be able to provide that. So an emergency department might be a better source for you to go to. Okay,
so definitely consider the emergency department. When would I definitely go to the emergency department? Like what comes to mind? What are your top 3 or 4 things like you need to go to the ED like right now?
I'd say chest pain, stroke, symptoms like that.
So facial droop, arm weakness, leg weakness, sudden onset, those would be primary symptoms of stroke, difficulty
Okay.
speaking or slurred speech. Yeah, those are usually the top two. It depends a little bit on age, but sometimes abdominal pain or
Yeah.
abdominal pain plus a fever, I would definitely lean towards the emergency department in that scenario. And luckily for us, we have a new emergency department opening in the community, but interestingly,
Yeah.
it's not attached to a hospital.
Okay, so I think what you're talking about, there's a new facility up on Amherst Street. I think it's run by CMC. Doesn't really matter, but what is that? Because it sounds to like I think what they've described as a freestanding emergency department. So how does that work? What does that look like since it's not a hospital right in our community? How would that work?
Sure. So as a freestanding emergency department, we have others in the state, so
Okay.
it's not new. Freestanding emergency departments actually were initially developed with the idea of kind of being out in rural areas to extend care and access to folks. But through the process of years and understanding that there's a free market, it became profitable even to put in, and I think a lot of freestanding EDs now are in more urban settings. So with that in mind, a freestanding emergency department has to kind of abide by the same stipulations that our emergency departments abide by, meaning, they can't turn people away. It's something that they have to assess the patient, stabilize the patient before any other treatment or discussions about payment or anything like that. So, but they also have to adhere to kind of the same standards of any other emergency department.
Are there differences as it relates to, for example, insurance? Because I know that both of the hospitals, you're both nonprofit, not-for-profit institutions. I think part of your mission is to take care of everybody regardless of insurance status. Even uninsured people can come to the hospital. Does that apply to also the freestanding emergency department in the same way? Or how would that work if I say it was totally uninsured?
Well, emergency departments are not allowed to turn patients away
Okay.
or to discriminate based on insurance status. So you should be able to access emergency care at anywhere that is labeled on the outside as an emergency department. So that should be the same as far as intake. But there are a few diagnoses where it would be to your advantage to go to an emergency department that's attached directly to a hospital. So if you're on Google Maps, you Google emergency room or emergency department, you could see if it's a standalone surrounded by lots of shops and commercial areas on the seacoast or in our area or up north, versus right next to or attached to an actual true hospital.
Yeah.
Yeah.
So what are the circumstances where it might make less sense perhaps to go to that freestanding department? I mean, if you have, I don't imagine a lot of people like get in the ambulance and say, where to take me. If my chest hurts, I'm going to say, take me to the emergency room, right?
Sure.
But what if, what are the differences based on where you might land, what type of care you might receive?
Sure. Well, I would say that the ambulance services in our community are pretty good about asking folks where they want to go or what hospital they're affiliated with. So they will usually try to make every effort to go to that hospital, which I think is really the best choice because we have all the records. A lot of patients are known to us. By the same token, the for-profit, freestanding emergency department can accept ambulances, but there's limitations. So that if there's something, much more serious going on, again, a heart attack might need a cath lab to go to immediately, or somebody having a stroke. It might be bleeding in the brain instead of a blood clot causing that stroke. They might need to go to the OR with a neurosurgeon. So those things are not something that's easily identified just by a physical exam.
Yeah.
So the concern is there fragmentation in care? Is there duplicative care that's going to occur because now we don't have the same access to testing and we have to repeat tests?
Okay.
Also, a potential delay in care. So if you have abdominal pain, fever, you go to the freestanding ER, they tell you, oh, you need emergent surgery, on your abdomen, somewhere
Sure.
in here. Then they have to then transfer you to another facility to get you that definitive care. If you go to an emergency department that's attached to a hospital, in this area, we all have surgeons available on call, and they have specific
Okay.
response times, but you're already in the appropriate facility to get that further care that you need. So any procedural care, sometimes orthopedics, if you have a complicated bone fracture, broken bone, something of that sort, then they are there and able to respond in a very fast manner. You don't need another ambulance ride somewhere else. So it certainly saves time.
Yeah, and time can be of the essence in these things. I do know from that personal experience, being transferred from one place to the next is not always easy, and it certainly is not going to benefit you time-wise, that's for sure.
Yeah, I can take a look.
Good. Well, thank you for sharing all of that information. I appreciate that. So I wanted to ask you guys if you have any personal stories about working in the emergency department that you'd care to share with people. It's a lot that goes on. We all watch, unfortunately, altogether way too many medical shows on TV. Sure, not everything is like Dr. House actually describes and prescribes.
Yeah.
Anything you would share about life in the trenches here in Nashua?
Without getting into trouble with HIPAA, I don't know
I
how much I can.
absolutely do not want you to get into trouble with HIPAA.
But what I would say is, when I first came to Nashua, I really didn't know what to expect. And I think as a young emergency physician, you're worried that am I going to lose my skills, or am I not going to see the variety that I'm going to see? And I was absolutely amazed at just the variety that we see here in Nashua. From the range of ages, and it is an aging population, but the acuity of how sick people are is really kind of humbling in some regards. So having a full-service community hospital or two in the same city, I think, has been a real benefit to the community overall. I think we've certainly seen changes in some of the dynamics in the city itself. But certainly not as much violence as other cities that I've been to. So,
yeah, and certainly it's a very diverse community as well, with a very wide economic spectrum, and also people from all over the world. Languages, I imagine language barriers become issues at times in the hospital setting as well.
Yeah, I moved up to New Hampshire during COVID, at the very beginning of COVID.
Oh, good for you.
So my first few years
We don't
here were
talk about
quite an
COVID anymore.
experience.
Especially with doctors.
Yeah, it was pretty horrific. But I would say Scrubs is my favorite medical drama because it's a comedy. It's about training. And The Pit, the newest show, is very realistic. And I can't watch it because it reminds me of residency training. And there's always an element of adrenaline and really sick patients. And we're just trying to do our best every day. So even if there's a wait time, sometimes there's a system issue, sometimes it's a staffing issue, but trust that we're always doing our best to see you and to treat you appropriately.
You mentioned COVID, and all joking aside, we also had that wave of RSV. It was 2 years ago, and I think some people were feeling a little bit like, oh, here we go again. I can't get into the emergency department. Where do we stand these days as far as wait times and capacity in both of your emergency departments?
I think it just varies day by day, but certainly like even on a Monday, we know we're going to see a higher volume of patients than on a Saturday. Wait times, again, early in the mornings usually are less, and as the day goes on and more people show up and need care, those wait times get much longer. We're always trying to do our best to kind of identify who really needs to be seen first, and move those people to the head of the line. It doesn't sound like a fair system, but it is a system that I think we rely on, because you never know if that person with chest pain is, just has some heartburn, or if they're truly having a heart attack. So it's important to kind of have the standards in place.
Well, I was shocked. You mentioned making sure that people get seen in the right order. My wife and I had to take our grandson to the hospital a couple of months ago in the middle of the night to the emergency department, not here in our community. but on the seacoast. And I was amazed how quickly they got him in. And afterwards, they said, "Oh, absolutely." If he was having some breathing problems, and he was 3 years old at the time, and they said that's going to be like you're going to be the first person we're going to see. Period, no question. We were in treatment with him in 15 minutes. It was really
That's amazing.
Yeah,
Yeah.
I was surprised and really gratified by that. And we came back out 3 hours later, and a lot of the same people were still there. So yeah, sorry. Maybe you need to bring a small child with you next time. Sure. But made a big difference.
And I think in fairness, there's certainly, I think, lower acuity patients that may have some emergent need. That's where a freestanding ED makes some sense. We're both
It's so difficult. Every patient thinks that they are having a true emergency, So it's really hard when you're uncomfortable or in pain to figure it out. We have some wonderful handouts now on, emergency department versus urgent care. So at Milford Urgent Care, we have several of them to help guide patients.
Well, that's really helpful. And I think some of that content also was shared with me for this particular segment that we're filming. We'll share some of that out as well.
Sure.
I think everyone thinks that they are the most important, which is very reasonable. So it's hard to get to everybody, but we do it.
Exactly.
Yeah, uncompensated care, still a really big problem with both of your hospitals?
Well, I think yes and no. I think the beauty of being an emergency physician or working in the emergency department is we don't ask. We basically, they come through the door and we treat. And even in our EMR, we don't see, you have to go digging to find out if they have insurance.
So not your problem.
Correct.
Your problem is treating the patient. Fantastic.
Yes.
I think we're going to leave it at that because that feels like just the right message too. So I wanted to thank both of you for joining me today and for your collaboration. It's wonderful to live in a community where we have two really robust hospitals that also work together and do so much for our community. So thank you so much for joining me today.
Wonderful.
Thank you.
Thank
Wheeler,
you.
appreciate it. Dr. Leahy.
Thank you very much. Appreciate it.
Right. So you've been listening to Living United with Nashua Business, and we've had with us today Southern New Hampshire Health and St. Joseph Hospital. And if you want to learn more, you can check both of their websites. Thank you and have a great day.